bathroom. One day I dropped my vial of insulin and then I let it slide. Oh, okay. Picked the glass up, threw it in the sanitary bin and continued with my life. But when I went back home, my sugar was so high. And my mom was asking questions that I couldn't answer. And I couldn't tell her, Mama, I didn't inject myself because I dropped my vial of insulin. Because she would have gone to school and shaken people up.
Yeah. Right.
So it happened. I went back to my normal.
If like feel out of place, maybe there's something wrong with you, you wonder why you have that condition. Because you need to manage your diabetes at the same time, go to lectures, you need to study, and you just have that extra baby with you that you need to take care of. So that was a great challenge. When I was in college, I normally used to sit at the back row on the lecture rooms so that I don't have to keep on going in and out, maybe going to check your blood sugar.
Welcome to Global Diabetes Insights, your go-to podcast for navigating the world of diabetes. I am Tino, a certified diabetes educator and a global advocate for non-communicable diseases.
And I'm Kona, a global advocate and a medical doctor. Together, we're your hosts, dedicated to raising awareness, fostering open discussions, and creating a safe space for everyone affected by diabetes.
Join us as we dive into empowering conversations with individuals living with diabetes, caregivers, healthcare professionals, and researchers. Our goal is to not only guide you through effective diabetes management, but also to inspire advocacy for proper healthcare access.
So get ready for a journey of insights, ideas, and diverse perspectives. Let's amplify our collective voice and create positive change. Get involved, get engaged, and join us in creating the change we need. So welcome everybody to Global Diabetes Insights.
Thank you. Welcome to the Global Diabetes Insights. It's an honor for me to have these two guys that I'll allow them to introduce themselves first. Maybe starting on my left, if you may introduce yourself briefly.
Hello, Tino. It's a pleasure to be with you guys today. I'm Rufaro, Gororo Norumetso. I'm a type 1 diabetic and recently certified diabetes educator.
Oh, wonderful. If you may go to the right.
Hi guys, hi Tino. Thanks for finally having me. It's been a long time coming. I'm Yemurai, Machirori, and I'm also living with type 1 diabetes.
Wow, wonderful. That's great. It's been a long time coming. These are the people that I really look up to here in Zimbabwe, the people that usually support me. I think we're going to learn more of what they've been doing, especially assisting me with my project at Farinat and the stuff that we do together here in Zimbabwe, living with type 1 diabetes. Though, of course, they were both diagnosed in the same way, but maybe I would want them to just take us back. Maybe they might not remember everything that happened when they were diagnosed. If they could just tell us what is it that they remember. They were both diagnosed in 2004, which is, I don't know if I should say weird, but it's not. So maybe if you may start from here, like what is it that you remember about your diagnosis back in the day? You were still young. What is it you remember?
I was diagnosed back in October 2004 when I was studying towards writing my ordinary level exams. So we were having a biology lesson. Then we got to a question which asked about the signs and symptoms of diabetes. Then we were saying out the answers: consistent thirst, hunger, going to the toilet a lot, losing weight. So as soon as we finished answering that question, I went to my teacher and told him that I'm experiencing these symptoms. May I please get a pass to go home?
Right.
Yes.
You're in boarding school?
I was in boarding school.
Wow, okay. Wow. Knowing how demanding ordinary level is, especially with everything that you're expecting, you want to have those flying colors because nobody wants to go to school and then fail. Mm-hmm. Then people start to think maybe they're trying to play tricks. Considering everything that comes with diabetes, before I say anything more, maybe want to hear from you. If you may tell us, what is it that you remember from your diagnosis?
I don't know. I grew up in a family with diabetes. My mom got diagnosed with diabetes when she was pregnant with me.
Okay.
But then if I tell you that she never picked on the signs, she never picked on the symptoms, I think I understand where she comes from because I'm now a mom also. I don't dream of my child ever having to go through what I go through. I think I understand where my mom was coming from. I was 11 in September 2004. So it's like a month before her. Yeah. A month before Rufaro, I got diagnosed with diabetes. I was 11. This was a month before my 12th birthday. I remember, because I lost so much weight. I used to be an athlete. I used to run a lot. But I'd lost weight drastically. I'd also been known as the person who didn't like eating. There's when you eat, you don't eat enough. I'm eating enough. I'm eating enough to survive. Why am I this tiny? I was about 20 kilos when I got my diabetes diagnosis, which is, I look back, my daughter's 2 and she's at least 15 kgs. Mm-hmm. So what do you mean I was 5 kgs more than her?
Wow.
So I was really tiny. I constantly played this day in my head. I went to see my GP. My mom says, you know what? I've come with her because she was our family GP. I've brought your child. Have a look at your child. She won't eat. She's particular. She's tiny.
Right.
And yeah, she says, I see nothing wrong with her because physically looking at me, there's nothing wrong with me. Yeah. But I'll order some blood and urine tests. We did that. And I didn't go to school on the day. I was about to go to bed. I think this was around 9 p.m. I was on my way to bed. The landline rang. And I picked up the phone because I was on my way to bed. And picking up the phone when you were young was, everyone liked picking up the phone. And then the person on the other end of the line says, is this Yemurai? I'm like, yes, it's Yemurai. Who am I speaking to? She's like, get your mom to the phone. So I called my mom. My mom's asking, who's it? I'm like, no, she didn't want to say who she was. My mom came onto the phone. Next thing is, get into your tracksuit. We are going out. Like, where are we going at 9? She went, she talked to my dad. She told my dad, she briefed my dad. And apparently this was the nurse from the medical labs that called. She says, I don't know how my afternoon colleague missed this, but your daughter's blood sugar is so high. She needs to be in hospital right now. So if you can, one of you take her to your nearest casualty and one of you come collect the results. My mom's like, but we only have one car. So I tagged along. And then my dad went upstairs, collected my results, took me to hospital. And I always say the doctor that attended me looked at my results. Literally, he came, he looked at my results, he looked at me, and I'm on the bed, I'm smiling. And then he walks out. He comes back in after a few minutes. He says, are you okay? I'm like, yes, I'm fine. Does it hurt anyway? No, it doesn't. No. I'm okay. I'm smiling. I can't possibly be sick. He says, but your sugar is very high. I think my reading was 53.5 at diagnosis.
Wow.
That's how high my sugar was. And he says, I've never seen anyone with a sugar this high.
So you're able to do whatever they do.
And yeah, you're still sitting, you're still smiling, you're not in any pain, you're not sick, you're not laying in a hospital bed. And then with those words, I was wheeled to the pediatric.
Wow.
But I remember when we were parked downstairs waiting for my results, saying to my mom, because then she came around explaining to me what was going on. I remember telling her, you know what? I think I'm okay with having a diagnosis of some sort because at least they now know what's wrong with me so they can help me. And also, I've watched you for the past 11 years injecting yourself, checking your blood sugar, doing finger pricks. I think I was content.
Wow.
I was content with the diagnosis.
Were you really 11?
I think so. Because then, you know what I then said to my mom, and she always so reminds me of this. I then said to her, when I grow up, I'd like to help children like me.
Wow, which is what you're doing now.
Which is what I seem to be doing every now and again.
You were 11?
I was 11.
Huh. Yeah. Okay, that's interesting. But one thing that I've learned in the years when I got involved in this advocacy things, many times I see women living with diabetes, but one thing that they will always say to me is that I would never screen my baby. I would know if he or she has diabetes, I would pick it up myself, but I wouldn't want to go to the clinic, to the labs to get these tests. They say, I'll pick it up. But you see, mom couldn't pick it up for you? I don't know. Yes, of course, losing weight, I think almost everyone has got a unique story to tell on how they were diagnosed, so which is interesting. So thank you so much for sharing your story. Now we want to dig deep on the things that you're doing. When you learned about diabetes, yes, of course, you're still in school, got diagnosed a month after my 18th birthday, not in 2004. Yours was in 2004. Growing up with diabetes, you've grown with diabetes. Now, yes, you're adults, you're now teaching so many people who have similar questions or maybe challenges that they're having because you know how to navigate them. So you got diagnosed when you were young, you were still at school. What can you tell us about your school experiences? What it was like mingling with peers, navigating all these challenges, all the things. Of course, you wanted to do sports. There were so many things. We didn't know which things not to do and things to do. Take us back when you were at school. How was it like?
When I was at school, I just noted that generally the public or the community don't really know about diabetes, the signs, the symptoms, the management. And people think that diabetes for the elderly.
Yes.
So you find that your peers really don't know what's happening to you. They don't even know how to manage hypos and all that. However, people were very keen to know what was happening to me, why you were taking injections. I was blessed with a group of intelligent peers.
Wow.
Yeah, they were keen to know the condition. I would generally wish that more education could be done in our community so that if anything like this comes to any other person, people already know the signs and symptoms so that it's picked up early before it's too late.
Can you say diabetes impacted your school life, your experiences on how you're doing things, your responses, consciousness? Because you know that there are times when you lose your consciousness when you want to focus. Because in class you need to focus.
You need to focus.
Can you say that diabetes maybe?
Yeah, it disturbs you. For example, study times, when you have hypos, you need to go to the hospital, you miss classes. Sometimes I remember when I wrote my biology exam, I actually wrote one paper instead of the two papers because the other paper I got sick.
Okay.
But I passed with a B.
Wow.
Yes. So there are those challenges of missing classes.
Thank you so much for sharing that. We want to hear from you how it was for her as well. Dealing with all those things, the school experiences, dealing with peers. Sometimes people speak or maybe say bad things unknowingly that they would hurt you or you're still young, but you know that these things are not supposed to be said. What can you tell us about your school experiences?
It was interesting because then I think for me, unlike Rufaro, who was much older, I got to experience it from such a young age. And that's where I learned of the stigma that kids can be bullied. That's where I learned it. I remember I was in grade 6. I wrote my grade 7 exams. Lucky for me, my teachers understood. And the rest of the children understood. It was only until I went to high school that things I could tell it's a new environment, it's new people, a different school, the workload has increased significantly. But the one thing, and for most people who know my story, know that I always talk about this because this was my first realization of diabetes stigma. I used to use vials of Actropid. You'd know Actropid. I used to use vials. Back then, pen sets, I think they weren't too popular in Zim, I think. Or maybe, I don't know, but I know we used to use vials.
Yeah, that's true.
Yeah, this was 2008. The Zimbabwean economy it was tough. Yeah. We used to get insulin in bulk. Whenever my parents got a hold of insulin, they'd get it for me in bulk because you just wouldn't know what tomorrow would be like. I used to carry my insulin in my blazer. Our high school blazers have those inside pockets. I used to put my insulin, go to school, put it in my desk because we had lockable desks. So I'd put it in my desk or put it in my teacher's desk, whichever. I've always been on a basal bolus. Each meal I need to bolus. So this one time, it's lunchtime, I want to eat, drawn out my insulin from the vial, and I want to inject myself. And this fine young lady comes to me and says, it was a girls' school, by the way. She comes to me and says, I think you should take your injections in the bathroom because they're scarce. So to me, I asked myself so many questions. Did someone send her? Is this her thought process? Because I'd come with this girl from primary school. She'd seen me injecting myself for a whole year. So, okay, where's this coming from? I'd have understood if it was Tino asking because Tino didn't know. Maybe he wasn't too familiar with the injections. But she knew. So then I'm like, oh, okay. I listened. And then I'd go, lunchtime would come, I'd inject myself in the bathroom. One day I dropped my vial of insulin. And then I let it slide. Oh, okay. Picked the glass up, threw it in the sanitary bin, and continued with my life. But when I went back home, my sugar was so high. And my mom was asking questions that I couldn't answer. And I couldn't tell her, Mama, I didn't inject myself because I dropped my vial of insulin. Because she would have gone to school and shaken people up.
Yeah. Right.
So it happened. I went back to my normal setting, injecting myself in the bathroom. I dropped a vial of insulin again. This time, I then drew the insulin from the floor and injected myself and then picked up my glass and then threw it in the bin again and then continued with my life. But then, that's also the day that I told myself that, this is enough. I can't keep doing this to myself. So the next time she then came back and kind of said, but I thought we agreed that you wouldn't be taking your shots in class. And I told her, you know what, if you're not comfortable, I think you're going to have to leave. You can go out when I inject myself, and then you can come back, because it doesn't even take me 5 minutes to inject myself. So I told her, if you're not comfortable, I think there's the door. If you have a problem, we can go to our teacher, and then maybe I can inject myself in the staff room. That didn't go well with her. So I went back to injecting myself in the classroom in my seat. But then the stigma, because then there was this friend of my brother's when I was younger, when I was newly diagnosed, I think. The one time he came to me and said, diabetes. As Rufaro said, diabetes is a condition for the elderly.
Right.
He said it in Shona though. In vernacular, that's like literally saying this is a sickness for the elderly, like it's a condition for the elderly. I was always conscious of myself. You won't get to 13 years old. You won't reach 13. In my head, it always played in my head. But then I never really associated that with stigma. It was only after I'd grown up. Like, what was this guy saying? So I reached 13 years old. I said, hey, I'm 13. Said, I won't get to 16. I looked for him again when I turned 16. Hey, I'm 16. And then when I turned 18, that it stopped. It stopped, because I'd make sure I'd look for, tell your friend I'm now 16. Tell your friend I'm now 18. He has to know.
I'm going strong.
Oh yes, I'm still going. And I'm now at almost 33 and still going.
Wow, that is amazing. Thank you so much. For recalling this thing. I think there were really sad moments. So those words, usually they will not travel from your head. You're always remembering them. People do say things not knowing. Maybe they know, they have the intention to hurt, but they just careless. They just throw words to say, come on, why don't you do this?
Yeah,
it's not like we did something together. I think I remember when I wrote my story, that is one, we still have misconception that people think that diabetes is a condition that maybe elderly people should only have, because I think we have now more than 589 million people living with diabetes, according to the IDF, that's what they say. So, wow, thank you so much. Do you relate in any way on what you said? Of course, I remember you say that you had the best support system. But in terms of people speaking negative words that stayed with you, anything like that?
Not really.
Wonderful.
But then, Rufaro, is always that thing. I don't know if it's a Zimbabwean thing. Let me not say African. It's Zimbabweans like saying, join a queue, even at a funeral. Everyone associates somehow diabetes has to come into play. Somehow. At all occasions, somehow diabetes has the sugar. The sugar. To remember periods. I don't know. It makes me cringe. Because then I feel, because then, I feel like a person without diabetes can even say, oh, I have diabetes, I need to eat. You with diabetes, because you look young, so you can't have diabetes, and you don't have any medical ID, so you can't identify as a person with diabetes. But you live with diabetes. It makes me cringe.
Yeah, it's something else. With our vernacular, our Shona language, it has these words that are just strong that you wouldn't want to associate yourself. I wouldn't want to call myself like Mogere sugar. But yes, also I can say names that I live with diabetes. It sounds so wrong. And I'm like, no. I think we need to find another way to do this. Usually, whenever they've been asking me like on radio to talk about this thing, sometimes I refer to saying, are you really talking about the condition I have? Or something else? Or can we rephrase it? So it's always like that. Now I think we are talking more about the language matters. Now there's a consensus statement to say, doctors, you need to use these words. People, like even in the community, you need to use these words. Because if you feel like someone is judging you or they're speaking with this not sympathetic way, you tend to be defensive in a way, because you don't want people to do that to you or against you, because you feel like it's just diabetes, right? So thank you so much for taking us back to reflect on the things that you experienced when you were still at school. But yeah, diabetes is diabetes. It's complicated. And I've heard one of the doctors saying, I've been treating people from these chronic conditions, especially the endocrinologists, the ones we refer to as the endocrine experts, people who work on these things, who understand the endocrine system of people. They say, I think diabetes is the most complicated condition. If we have to talk about chronic illnesses, you can say that because it's unpredicted. Today, I can take the same food, but tomorrow it has different meaning, different numbers that I'm seeing on my glucose. enter. So it's always that difficult. We're moving out to college. Yeah, the people, they don't really share much about their college life. What they did is another chapter. We talk of independence. High school or at school, you still had parents taking on you. I remember when I was going to the review with my mother, it was like she was talking with my mom, not me. And then my mother would have to then translate whatever was said to her. You need to do this. This is what the doctor said. I would never listen. I would just be in the room. Just think maybe at college now you could now go to the hospital by yourself. I don't know if that was the case, but maybe if you could tell us. We're now talking of independence. We're now talking of academics and also this diabetes. Growing up, we know even the demands, they increase as well when you become a teenager. Or you're already a teenager, or maybe you're in your 20s, reaching your 20s. So what can you tell us about that moment in college?
So for myself in college, you sort of like feel out of place.
Right.
Maybe there's something wrong with you. You wonder why you have that condition. Because you need to manage your diabetes at the same time, go to lectures, you need to study, and you just have that extra baby with you that you need to take care of. So that was a great challenge. When I was in college, I normally used to sit at the back row in the lecture rooms so that I don't have to keep on going in and out, maybe going to check your blood sugar or eating. So I'll just sit at the back row so that I can eat. I can just be free to do
Whatever you want.
anything that I want. Yeah.
For me, I think from primary, I was always a front bencher. And for me to keep myself engaged in a class, if I feel like I'm sleeping, I'll raise my hand and I'll try to participate in whatever the teacher was saying. For you, what like just tell us from your college experiences.
I've made my best friendships. There's this one friend of mine from high school.
Right.
I have two that I met in college. I'm so grateful for that. Meeting people who don't even have people living with diabetes in their families at that time. Now they all do. Having people understand you, having people who cover for you when you can't cover, when you can't be there. I remember I had one of my most severe hypos when I was in college, first year college. So it's something that doesn't leave you. But this friend of mine made sure I was caught up on everything, on the college gossip, on the notes, the lecture notes. Oh yes. I was always caught up. College wasn't, I think because then I also then had my own mind, diabetes wise. I think it wasn't much of a hassle for me to go through college. But yes, you'll have the hypos, you'll have the rebellion from high school into college, still it follows you. So I never really got to stay away from home. I got diagnosed with diabetes. I was supposed to go to a boarding school for high school, but no, my mom then said no. I have to keep an eye on you.
Similar experience.
I was a day scholar. I went to a day school throughout high school, my 6 years in high school. I went to a college where I could walk from home and come back home every day.
I said no to that.
So yeah. So I can't really relate from that experience because I only got weaned off my parents completely when I got married. But because otherwise I'd go wherever I'm going and then I'd come back. I'd go for 2 weeks, I'd come back. But I met my first diabetes network when I was in college. That's when I joined the Young Leaders in Diabetes. For me, that was a game changer because all this while I was happy cruising with an HbA1c of over 10. I saw nothing wrong with that. I never even used to go and to get my HbA1c checked. I just didn't care. But I met this awesome group of people and actually realized that no, I can be more than what I think I am, more than I think I can be. It opened up my mind, it opened up my heart even. From then onwards, I managed to lower my HbA1c, and I think for over 10 years now, I've been sitting at 6 point something. 6.2, 6.5, that's the most it's gone up to for over 10 years now.
Wow.
But then that's only because I met people when I was older and I met people who changed my life. See, unlike Rufaro, who got diagnosed with diabetes when people were more mature, she had a more mature bunch of people around her. I was still experimenting. Also an adolescent. I went into teenagehood. I went adulthood.
Now that you have brought up already the topic that I was going to talk about later, about the young leaders in diabetes. Now I know that you also served as the Africa representative for some time, and now you're a mentor. People can actually come to you. I remember coming to you asking questions about how this was for you. And I also got involved in the same program when I was in college. That's when I got involved in advocacy. Maybe what could you tell us how this has really shaped your life professionally or just your natural life as a young leader in this program for the young leaders in diabetes? Idea.
It was a game changer because then only you're not just looking at diabetes in your country, you're looking at diabetes in the continent. You gain so much insight. I gained so much insight during my involvement with the IDF's program and other advocacy groups, because then I also then joined T1 International. It was really eye-opening for me. And the networks, the friendships that are formed when you join those networks are like magic. They're literally the friends that you never knew you needed. It's the community that you never knew you needed. Because it's a community that's filled with people who understand you.
No judgment.
No judgment, yeah. From different parts of the world, even different countries. But then, it's so funny how most people in Africa can relate to the African scenario. I guess our health systems are similar in one way or the other. So I don't say it in good faith because the health system is really shaky.
Yes.
I think it grooms you. I know we've lost so many people, so many young people living with diabetes. Others who Stuart held my hand from the time that I got diagnosed with diabetes. For instance, there was a lady from Nigeria, her name was Oprah. Oprah was also very active. Then we lost Oprah, not because they weren't taking good care of themselves, but then because of our health care systems that aren't up to the most commendable ones. It opens your eyes, it makes you vulnerable, but it makes you stronger also.
Wow, thank you so much for sharing that. I could just reflect on everything that you're saying. Also, the network that these things open up for you, the things that you didn't know you need, but now you get the support. Sometimes people do check up on you. Yes, so thank you so much for sharing that. So this question I wanted to ask both of you, Rufaro, because she has much experience in this. For you, Rufaro, I think because you're a mother of four, there are misconceptions under this subject. People with diabetes are always asking, I've always had this in our support groups, people asking these questions. Maybe it's something that you've encountered, how you have dealt with these misconceptions. If they are still there, what are they? What can you tell us about motherhood and managing diabetes?
Motherhood and diabetes. The main misconception on that issue is that it can be impossible to have a baby with diabetes, or you have a very challenging and unhealthy pregnancy. However, in my experience as a mother of four, it's important to study about diabetes. Know the condition, know your body. Knowledge is power. Once you know your body and how it responds to different types of food and your insulin doses, you can be able to manage it and have a successful pregnancy and deliver healthy babies.
Wow. You have the babies?
Yeah, because she's got four.
She's got four. Wow.
She knows what she's talking about.
Thank you so much for this one. I think it's most difficult to manage diabetes for women than it is for men.
Especially true. I support.
Because I know 3 months before pregnancy, you need to see a gynecologist, and then for the duration of the pregnancy, I mean, we're talking of 9 months, making sure that your blood sugar is in range. Even for me, it's difficult.
Every hour.
Right. So its weight is difficult. That's why sometimes when the babies are born and then they're really big. Imagine delivering a baby who is 5 kgs plus. Imagine that. So many times, I think these are some of the things that we're seeing in the community, things that we believe should be talked about more. Thank you so much for sharing all that. Yes, for you, you're a mother of one, but
she's super mom.
Yes.
But contrary to that misconception, my baby was tiny when she came.
Oh.
My baby was tiny. Because also I had preeclampsia. I got diagnosed with preeclampsia. So my blood pressure was really high, I think from the halfway mark of my pregnancy. She was a late preterm.
Right.
And she was tiny, she just wasn't growing in my tummy. And my gynae always says, he was almost convinced, I think because he's also Rufaro's gynae, and he saw how Rufaro's babies were growing.
Were you asking her?
Actually, I did. I did.
Oh, okay.
I did.
Okay.
With Rufaro's experience and the experience that he had from different mothers with diabetes, I think he expected my baby to be bigger than she was. But my baby she was 1.7 kgs. She was
The power of network. I think it's really important.
She was tired.
If the guy you are seeing more than 10 people living with diabetes who also delivered babies and never had an experience with the case scenario that you had, they'll probably tell you things because mostly they are basing on experience or things that they've seen to say, this is very unusual. We've never seen this. Tell you to do things that you never thought you'd want to do.
Yeah.
But I mean, you deliver. The baby is now big. Big.
She's big. She's a big baby now.
This is amazing.
It's also, I don't know, just our healthcare system is. I had a difficult pregnancy.
Oh, okay.
I had a very difficult pregnancy, not because of the diabetes. The diabetes was fine. The blood pressure. And if I tell you that at some point, because I'm on a medical insurance, I was told only 2 scans for the whole pregnancy. So this is the 10 months that I'm supposed to be carrying this baby. 2 scans. I was in hospital 2 times before I delivered. And each time I had to get a scan. I had to get a scan because my blood pressure wasn't playing nicely. So my gynae said, you need to go for a scan once every 2 weeks. I approached my healthcare provider and told them, like, there's nothing we can do. My pregnancy was already high risk because I live with diabetes. I felt there's a gap in our healthcare system. You know, you have a chronic condition. So yes, you're automatically high risk when you fall pregnant. But then, you know, they don't, no adjustments, nothing.
Wow.
No adjustments. So even when my essential medicines benefit ran out, they said you can buy yourself a lower, inferior insulin to the one that you're using if you can't afford to buy the insulin that you're currently using. I tell you, my physician was so angry. He was angry. So where's the humanity? I don't know, man.
When you go to see a doctor, you're expecting maybe this to get comfort, not to be judged. Because I've seen many times from people within our community, I no longer want to go to see this doctor because of the things that he says to me. I remember, I think it was 3 days ago, one mother came to the clinic. I wasn't there because most of the times I have to be there in the hospital assisting. And then she said that one of the doctors she was junior. She wrote in the book that the mother is not taking good care of the baby. So she read that word when she got home. She said, if I had seen this when I was still here, I was going to confront the doctor.
Because it's difficult taking care of. I mean, I'm an adult. I live with diabetes, but I can't imagine taking care of my child
with diabetes.
It's
hard.
Yeah. She was really furious and she was angry to see that. So I think the healthcare professionals in our system. Yes, of course, we talk about healthcare systems. It's broad. We're talking of access to medication. We're also talking of the care that people with diabetes are getting. So if it's not really optimal or if you don't feel supported, you wouldn't want to see that person again. That's why we see that most of the people are no longer, don't feel okay going to the doctor. They only want to go to the doctors when
there's something wrong.
When there's something wrong. But it shouldn't be like that. After every 3 months, you need to go back to see a doctor. You should laugh it. And most of the times, it's 5 minutes or less. So now we're talking about something that we've been doing together, the 3 of us. Both of you have been at all our workshops at Parinyatra with the project that you were doing, the roles that you have played. I wanted to know if you could share with us, what is these gatherings meant to you? What role does the community have in your advocacy journey? Because in your busy schedules, you'd always make time to come. Not because Tino asked, but it's something that you felt it's needed. You needed to do it.
Growing up, I really never got a chance to meet a community of diabetics.
Wow.
So everything about diabetes, I taught myself through studying, going through YouTube, reading medical books and everything. I found these communities very important for the patients and the caregivers at home. They just help you know that you're not alone in this journey. When you are dealing with a hypo at 3 a.m., you just know that when I was at the workshop, somebody told me that they also had a hypo. It motivates you, it keeps you going. It gives you hope for the future. And meeting someone who's been diabetic for 20 years, maybe you are still in your early years, it gives you strength. So I've seen these communities very helpful, and that's why I always want to be there to encourage others, because I've had a long journey. I have a lot of stories to tell over the last 20 years.
Wow, thank you so much. Maybe you want to add to that?
I concur. I also mentioned earlier that there was no community. When we got diagnosed with diabetes in this part of the world, it was just a condition for the elderly. You know, now I feel in my heart strongly that when you walk alone, the journey is so long, it's so tough. But just add 1 person to the journey, add 2 people, add 10 people, then you know what? It's a whole lot shorter. Seeing those kids, it warms my heart up. Because you know what? They're trying. The one thing that I know for sure is that those children are resilient, because just waking up every day, having a go again with your diabetes is a lot of work. It's a lot of commitment. I always say that diabetes gave me a second chance of life. And I think for those children and their parents too, you don't know, maybe just my face and not even saying anything can change a person's life. So why not?
Thank you for that. I think the first 9 years when I got diagnosed, the first 9 years I was a nobody, I was very rebellious. It was only my mother who would do everything to make sure that I'm okay. But now tables have turned. When she sees someone with diabetes, wherever she's going, she's always giving her my number. She doesn't even ask for my consent. I'm like, why are you doing that? She's always doing that. She said,
because we're mothers, that's what moms do.
With everything that we've learned, I think for you, you know that speaking up takes a lot of courage, and it's something that we always want to do because you had the best support system and now you feel like you want to support others. Briefly, what inspired you to do what you're doing now? We always need that to come together, be in a team. Diabetes educators, people living with diabetes, and also healthcare professionals coming on board to speak about these things in the same room to other people living with diabetes. They get inspired. Sometimes they relate more with what someone with diabetes has shared, more than what the doctors have shared.
I was inspired by what I learned from other people who were advocating for diabetes because they encouraged me. And I saw that I also have a duty to encourage the people in my community. So I really empathize with everyone, the diabetic patients, the caregivers. I have first-hand experience as to what they go through from morning till evening, the multiple injections, feeding and everything. And I know how it feels. I just want to educate others and help them know that we can walk this journey together and we are winners and we can be anything we want in life.
Wow. Wow. Thank you so much for that. For you, I would want to rephrase it. You say that you joined the Young Leaders in Diabetes when you were in college. So was it the opportunity that came to you that made you to do what you're doing? Or you already knew what you wanted to do? So you wanted to speak up, you wanted to do things like this.
Remember the night I got diagnosed with diabetes? I don't take that lightly. I don't take what I said then 21 years ago lightly. That I wanted to help the children. When I got diagnosed with diabetes, the youngest person I knew was living with diabetes. I met when I was 18 and I'd finished high school. That's the first time I met someone living. Yes,
It was 9 years after.
Yeah, maybe lucky for me because then I went to a school, the high school that I then went to do my A levels. There were 2 people living with diabetes. Two children living with diabetes. One's late now, but then I'm still in touch with the other one. He's younger than me. We have a good chat every now and again. That's what motivates me, that these children, I'm very passionate about children living with diabetes. And these children need a community. The injections, yes, they're there. They need medical support, but they need a listening ear. Their parents sometimes can't listen to them because they feel they're sulking and they're not appreciative of what they're doing. Just sometimes you talk to a mom and you can literally tell that she's glowing after your conversation. The perspective has shifted. And it's so fulfilling. You talk to the child and she's like, can I have your number? I'm like, oh yeah, sure. You can talk to me at any time. You can talk to me at any time. It lifts up your spirits. I remember when I used to go to Pari for the kids sessions.
Which I'm not doing now.
Yes, yeah. It was always really fulfilling. It's something that I'm looking to maybe explore again.
Right.
I'll see. But then life has changed drastically from that time. I'm now a mom. I'm going to work full time. It's a lot. There's still so much work to be done.
Each time these things are happening, people ask me, what do you get in return? I have to lie to other people when they ask me, are you getting paid? Because I wouldn't want to deal with it. Because people are so judgmental. They'll be like, so why are you doing it if you're not getting paid? I'll be like, of course. Do you think I'll just do it? Hopefully they're not going to hear this audio. So thank you so much for sharing all this with us. Living with diabetes, now advocating for other people living with diabetes. What is that message that you would want to share with other women living with diabetes in Zimbabwe who feel silenced, who feel unseen? What would you want to share with them? Because I know that there are other women now who are having so many struggles because they never had a community or never read anything about diabetes. They just know what the doctors are saying to them.
Now, I would advise other women to personally take the initiative to learn more about diabetes because it will help them. And at the same time, when they are educated, they'll also be able to educate their families, their communities, and it will create a knowledgeable community about the condition.
And then from you, yeah.
What Rufaro said.
Wow, thank you. And the one thing that I've learned, if you learn something, if you want that thing to stick in you, you need to teach someone.
Pass it on. Yeah, that's
Pay it forward. That is the thing.
Yeah.
You don't just learn and then sit with it. That's why now I say I think I want to hang my boots because I feel I've been attending conferences since 2020 and now I think like almost everything that is being shared there is the same. So I want others to get the opportunity again. But when people see me doing what I'm doing, they'll be like, Tino wants to grab every opportunity, he wants to do everything. Sometimes I get invited. So people don't always see it that way because opportunities will start to come when you take the initiative first, like you say. Start doing something because that's when you get seen. People first they want to say, okay, am I going to get money from this? We don't get money from this. We don't get paid. You have to have your own money. So you have to get invited. You don't just get invited. They can pay for your trips. They can pay for your accommodation and then give you money for pocket money. You need to have your money. Okay, that's the thing. So thank you so much for this. I mean, we've been talking about how fragmented our healthcare systems is in Zimbabwe. If you could sit down with the Minister of Health, what would you tell them if they say, can you make it one priority? Because I think almost in every ministry, they have these demands that they're always discussing in Parliament. But if you think for people with diabetes, something that you think can transform lives now, what is that one thing that you'd want to see change in Zimbabwe? If we could have one thing. Not so many. We know there's so many things. If they could be one thing that you feel this can transform every life of people living with diabetes in Zimbabwe. What would that be?
Affordability and accessibility of insulin.
Wow.
Yeah, and other diabetes medication. Maybe subsidize the costs because this is something that everyone needs, daily. Like, other people take 4 injections every day. It's really costly.
Yeah, we are other people.
Yes.
No, definitely accessibility and affordability. It's one thing that insulin is insulin. Maybe that's their argument. But insulin is not just insulin. I always say that there's no reason for a 4-year-old or, a teenager to be on mixed insulin. They're so experimental. A lot happens at those ages. Why can we not subsidize insulin? The argument then is the doctor prescribes a basal bolus, but the parents can't afford to buy 2 insulins at a time. So what's the next best option? The mixed insulin. But the doctors are constantly arguing that these are not the best insulins for children at this age. We'd rather maybe people living with type 2 diabetes be on the mixed regime. But look at us. How many years later, over 100 years later, after the discovery of insulin, we still have areas that if I go Kumushatino, do you think I'll be able to get insulin? Yeah, if I go, no, not just the one that I'm using, even just insulin from the general hospital in my rural areas, from the clinic in my rural areas. So, diabetes needs to not only be treated at city level, but then from the grassroots. Where's the grassroots? Where that clinic there in my rural area, the nurses probably checked blood sugars when they were training to become nurses. But when they went to that clinic, a glucometer was never bought. So a person with diabetes goes, and then what happens? Do they even have glucose to treat us when you get into a hypo? So it's a lot. I'm really passionate about this accessibility from the grassroots and affordability.
I don't know how to say it, but thank you. Yes, this is what is happening. We know that to get the best care, you need to come to the areas. That is still the thing in many African countries. But I think with these initiatives that are still coming, maybe I'll give a big shout out to what the Class is doing. They're starting in Mashingo because we'll promise that in the next few months. That's what they say, but we haven't seen these things yet. So now I feel like sometimes I don't want to tell people everything that is discussed because you always want to tell them when it's there.
Yeah.
You have to say promises, things that have been said to say we want to reach out the 6 provinces, but we're just holding on to it and seeing how best these things are going to be there. Because I think it's also needed that wherever you are, you need to be getting the best treatment. Capacity building is important. Healthcare professionals needs to be trained. Not just the training they got when they became medical professionals. Yes, that is the thing in Africa. I've always been saying that. Because they don't get the exposure that other people are getting now, especially going to conferences, attending conferences. Because these doctors from the US, they are getting sponsored by their hospitals to get training. It benefits the hospital. So I think it's something that is needed to be done. As we close, if we could, from your daughters, your mothers, waking mothers, if they are to look back 10 years to come or 20 years to come, what is it that you'd want them to remember about the life you've lived, living with the condition you're living with, doing the advocacy you have, welcoming other people to contact you on your personal numbers, whatever time, to ask questions? What would you want your children to remember?
I would like my children to remember that they are the masters of their lives. They need to remain positive about everything, whether is it a medical condition, careers, anything to do with your life. Have faith and take one day at a time. One day at a time.
Wow. Would you want to add anything?
Oh yes, that I'm such a super mom.
All right.
Well, just to add on to what Rufaro said, just living with diabetes is a lot of work. My daughter's only 2, but she will see me holding my glucometer and she'll say, glucometer.
Right.
And then she'll see me taking my shot and she'll say, Mama, do Jackson. Because she can relate. She's relating. She's seeing. I'd really love to remember the resilience. I always say that my diabetes control became tighter after I'd become a mom. Because I want to see everything. I want to be there for as long as I can, for as long as possible, as my body allows, as the diabetes allows. For as long as God allows, I want to be there and I want to experience everything. That's one thing I'd like for my daughter now and the future ones, to always, the future,
Yes.
the ones to come. They need to know, that Mama was strong, Mama was resilient. Even when things were hard, she took it a day at a time.
Mm-hmm.
As Rufaro said, that they're the masters of their lives. The world's their oyster, they can have it.
Thank you so much. If diabetes has taught me one thing, it has taught me to be responsible at a tender age. Remember, when I was still at college, my friends would go out and then they were drinking. For me, even if I had enough insulin, I just needed to have that other money that's not budgeted on anything because I knew I would need something. So it has taught me to be responsible in a great way. And some people say that I'm a bit stingy. I don't know about that. But I think it's really amazing. So thank you so much for sharing your stories too. It's just going to empower and inspire so many other people who are going to listen to this. Yes, I know that it has been a long time coming because this we needed to do it. So thank you so much for taking your time. It's a weekend. You're supposed to be resting, but you took the time to be here. I cannot thank you enough. And the community who are going to watch this, they cannot thank you enough. I wish we had recorded it in our own language. Why didn't you? You didn't ask me that. So thank you so much. And before being said, we're Starcast. Thank you so much, Yemurai, and thank you so much, Rufaro, for all this that you've shared with us.
Thank you, Tino, for having us.
Thank you, Tino.